Hello, my name is Dr. Sam Robson, and this brief webinar is to explain how to use and interpret the InBody 770. This machine is the gold standard for assessing and monitoring body composition whilst on the Temple-V program. This assessment is conducted throughout the weight loss and stabilization stages every 4 weeks. During the maintenance stage, this assessment is invaluable for guiding lifestyle choices and allows for an objective overview as to when a patient needs to modify what they are eating or how they are exercising. The InBody uses bioelectrical impedance technology to provide an analysis of a patient's body composition. This analysis includes body fat percentage, lean muscle mass, visceral fat, which is the fat that is packed around the internal organs. It provides an overview of the body fluid balance, and it enables us to understand the basal metabolic rate. This is the amount of calories a body needs to just stay alive. An individual's basal metabolic rate is mainly determined by their age, their sex, and the amount of muscle in their body. If you have more muscle, you have a higher basal metabolic rate and therefore can eat more calories without gaining weight. I shall come back to this later. The examination is quick, lasting just 30 seconds, and relays the information wirelessly to a dedicated computer from which a comprehensive report can be printed. Data are stored on the computer for future reference and information gathering for audit. Studies have shown the InBody to be almost as accurate as a DEXA scan, which is what is used in hospitals when undertaking body composition analysis. The results of the InBody assessment will guide the advice provided to the Temple-V patient, as well as providing an update on their progress in response to being on the program. This objective feedback can be invaluable in helping patients to understand the importance of changing their diet and exercise routines. This slide shows the standard InBody report, and over the next few slides, I shall go through all the various sections explaining the significance of each part and how to interpret them in a meaningful way. The top section on the left-hand side of the InBody report gives an overview of the basic body composition. The important results here are the minerals and the fat-free mass. The minerals weight is a good indication of the patient's overall bone density, and low levels can be improved by weight-bearing exercise. If the mineral result is well below normal, then there is a risk of osteoporosis, and we should notify the GP. As you can see from this report, this patient has a relatively high level of minerals, and so this isn't a risk. The other important result I mentioned is the fat-free mass, which is their body weight minus their body fat, and this is used to calculate a target for weight loss. This next section relates to muscle fat analysis. It is helpful to look at the three results under muscle fat analysis together, that is, total weight, skeletal muscle levels, and body fat mass. Just looking at the pattern of the bar charts here provides a quick visual clue to the underlying body composition. Here we've got the results from two people. Now if you join the ends of the bars up, we can see either a C shape, which is here, or a D-shaped curve. The C-shaped curve means that the patient has more fat than muscle. A D-shaped curve here means the patient has more muscle than fat. Patients who need to lose weight almost always have a C shape. Many people can get hung up on what the bathroom scales are telling them, but as you can see, these two reports are of people of roughly the same weight. But this one has a good muscle level, see here, and here, this is the fat, and this one has too much fat. See, the muscle level is much lower than the fat. If you remember earlier, I told you that basal metabolic rate is partially determined by the amount of muscle in the body, and having a higher basal metabolic rate means you can eat more calories without gaining weight. So this person will be able to eat more without gaining weight. This is one of the main reasons for encouraging patients to gain muscle, which will raise their basal metabolic rate. This next section is called Obesity Analysis. The top result here tells us about the BMI. This is the body mass index. But this calculation is only based on an individual's height and their total body weight. The total body weight, as measured on the bathroom scales, tells us nothing about how much of the weight is fat and how much is muscle. If our goal is to have more muscle in our body, then it makes sense that more of our body weight is made up of muscle, and therefore less of our weight will be due to fat. The bottom result here tells us about the amount of fat in the body. We should pay attention to this. We advise patients of the ideal for their age and sex, and generally we're aiming for someone to have less than 30% body fat if they're a woman and less than 20% if they're a man. This will give them a healthy body composition. The next section relates to the segmental lean analysis. This is probably the most useful section for personal trainers and when monitoring progress in the gym. This indicates the level of muscle in the arms and the legs and the trunk. Each section has 2 bars against the scale. The top bar indicates how much muscle there would be if a patient were at the InBody's ideal of target weight, so we shall ignore this and focus on the bottom bar. The bottom bar, here and here and here and here and here, indicates how much muscle is actually in the body at this point in time. We should note any discrepancies between the right and left limb. Generally, a right-sided person has more muscle in their right arm than their left arm. This person, we would deduce, is likely to be left-handed because they've got slightly more muscle in their left arm than their right arm. If this doesn't follow the expected trend, then it is worthwhile finding out if the person has had any injuries or whether they are doing something on one side that they don't do on the other. The segmental results can highlight which areas need to be focused on in the gym, and it can be helpful if the patient takes this InBody result sheet to their appointment with a personal trainer. This can be helpful in reinforcing which areas could be focused on with resistance exercise. This report suggests that the focus should be on the legs. We see much less muscle here than there is here. ECW ratio analysis is looking at the ratio between the extracellular water, which is ECW, and the intracellular water. This is a measure of the body's fluid balance. The doctor will consider the information presented here, along with the patient's blood results, and this can help determine whether the daily supplements required on the Temple V program need adjusting. The body composition history is down at the bottom of the InBody report sheet, and this gives a snapshot of all the InBody measurements over time. These graphs at a glance give a good guide to progress. For this particular person, we can see that the weight has dropped by 17 kilos, which is nearly 3 stone, and the percentage body fat has fallen by more than 10%. But the amount of muscle is relatively stable, having dropped by only half a kilo, so this shows excellent progress. Now if we look at the top of the InBody results sheet, we can see at the top right-hand side of the printout is a number, which is called the InBody Score. This can be interpreted as a measure of the patient's fitness. A good guide for patients is that a score between 60 and 70 is good, 70 to 80 is very good, and 80 to 90 is excellent, with scores more than 90 tending to be reserved for those who are very athletic. Many patients will start with a low number, possibly even down in the 30s, So it is very motivating for them to see their overall fitness improve on this score, particularly when there is little weight loss due to muscle gain. This next section is probably the most important one from a health perspective. This visceral fat measurement gives a powerful visual result about how much fat the patient has packed around their internal organs. This visceral fat has a high correlation with the risk of future diabetes, heart disease, cancer and stroke. Patients may feel that they're not very overweight, but the InBody can demonstrate the dangerous hidden weight on the inside, and these people could be determined skinny fat. See, this person has a high visceral fat and this person has a low visceral fat. Men in particular are at risk of carrying high amounts of visceral fat, and it is for this reason that many men will gain weight having only an enlarged tummy but little apparent fat elsewhere on most of the body. This means that most of their fat is packed around their organs, and this poses a risk to their health. The InBody measures visceral fat in square centimetres, and you'll see from this graph that there is a line here and here, which is at 100 centimetres squared. The dark grey zone is here. This is considered to be the acceptable visceral fat. This light grey zone is where we really aim to go because this is a healthy level of visceral fat. The weight control section is generally ignored by the doctors leading the Temple V program. We don't use the target set out here by the InBody because the machine makes these calculations based on the perceived ideal fat-free mass rather than what is actually being measured. This can result in abnormally low numbers. Temple V doctors will be taught how to work out targets for individual patients, and this is based on their measured fat-free mass, which was the first section that we looked at. This section, titled Segmental Fat Analysis, provides an indication as to where patients have their subcutaneous body fat. Most patients, as in here, will hold the majority of the fat around their trunk. Upper limb fat can often appear to be higher in women due to the InBody machine including breast tissue in the measurement. Next to each section is a calculation of the mass of subcutaneous fat in any particular area. Some patients will be motivated by comparing previous reports and seeing exactly how much fat they have lost in each section. The only measurement detailed on the research parameter that is of interest is the basal metabolic rate here. In summary, the InBody is invaluable for understanding more about body composition. The information is used to prescribe the Temple V program, and it guides the doctor in setting the target weight as well as providing the information required to calculate the length of time a patient will be on the program. The graphs, bar charts and illustrations of the various parameters provide a quick visual aid to understanding how the body is changing in response to both the Temple V program and modifications in diet and exercise. It is a great tool for tracking progress. Thank you.